All right, welcome to the January Board of Health meeting. It's good to see you all, that you're healthy and moving there against all odds. I'd like you, Kim, to call the roll, please, and have each of us state our name and our location as required by remote meetings. So if you would unmute yourself, Kim, and do that, I'd appreciate it.
Okay, Vanessa Brown.
Vanessa Brown, Benton Harbor, Michigan.
Okay, Margaret Coring.
Margaret Coring, Weesaw Township.
Dr. McBride.
Ray McBride, Berry Springs, Michigan.
Okay, Joe Wasserman.
Present, Coloma, Michigan.
Dr. Edwards.
Present at Southwest Michigan Orthopedic in St. Joseph, Michigan.
Ray Matajic.
Ray Matajic in St. Joseph, Michigan.
Linda Stroll.
Linda Stroll, Sawyer, Michigan.
Okay. Nikki Britton.
From the Berrien County Health Department in Benton Harbor.
Courtney Davis.
Also at the Berrien County Health Department in Benton Harbor.
Okay, Jillian Conrad.
From the Berrien County Health Department in Benton Harbor.
Dr. Johansson.
I'm in the Berrien County Health Department in Benton Harbor, Michigan.
Lisa Inkerbrook.
Berrien County Health Department in Benton Harbor, Michigan.
And Lisa Peoples-Hurst.
Berrien County Health Department, Benton Harbor, Michigan.
All right, thank you all. So glad to see you and welcome to the meeting. Thank you, Kim. You have the minutes that Kim has faithfully prepared in front of you. May I have a motion for their approval?
Ray
So
moves that
moved.
we accept them as written.
Okay, so Ray has moved. Is there a second?
Second.
Linda.
Okay, so Vanessa, you second. Is there any discussion? All right, hearing none. All those in favor?
Aye.
Opposed? Motion carried. Thank you very much, Kim, for your faithfulness in doing the minutes. They're extensive and well done, so I appreciate it. Lisa, we have vouchers in front of us. Is there anything unusual we should be looking at?
There was only one item of significance that I saw. On the last page for Vital Smarts, there's a purchase for $5,980 for educational materials related to leadership training that we're doing for staff. It included crucial conversations, and as part of that, getting things done, and crucial accountability training for staff.
All right, thank you.
Just to note, those purchases are coming from the Kresge Foundation grant that we had and had been through the Finance Committee for approval.
Okay. So do you want us to do a motion on this of ratification or not?
I don't know that one is required. Lisa, we don't need explicit approval, do we?
No, we don't. It's just a payment and the contract that had been previously reviewed. So it's just sort of a check the box.
Okay. All right. So you have the vouchers in front of you. May I have a motion for their approval?
Ken Edwards, so moved.
Okay. Edwards moved. Is there a second?
Ray
How
will
about you,
second.
Doug? Okay, Ray, second. Thank you, Ray. All those in favor?
Aye.
Aye.
Opposed? Motion carried. I see there are no resolutions, but we have the delight in a 20-year recognition. Woohoo, Lisa.
Woohoo!
Thank you. let's hear a little bit about Lisa.
I'll turn it to Courtney to start.
Yeah, so yes, we're glad to have Lisa here for 20 years today. For the last year and a half, almost 2 years of that, she has been our public health promotion and prevention supervisor, and has had a great first couple of years of doing that here in pandemic, and a lot of transition that has to happen during that time. But I just think a couple really great things about Lisa is she's incredibly passionate about the work she does. She cares deeply for our community, substance use disorder prevention, and working with our youth and our partners is just something that I think gives her energy, and she loves to do it, and she brings that with her to work every day. She's incredibly thorough in communication. We have amazing partnerships with Southwest Michigan Behavioral Health, who is our primary funder. She's incredibly on top of communicating with them and being able to adapt to what we need to do with our work plans. Voice Change Hope has had quite a transition here post Carol's Hope being a focus, and she's really ushered that group through kind of a regeneration and new membership and really finding focus in this time of pandemic. And so again, she just brings a lot of that communication to our partners. This year has been a year of change and moving things virtual, as well as just a lot of change with our school. And she's been really on top of just continuing to look for how do we innovate, what new trainings are out there, what new programs, what's evidence-based, what fits within our funding. These are all things we have to balance together. And she has just really embraced being able to do that, vet new programs. I really appreciate just like the leadership and initiative that she takes with her team and moves that work forward. She knows what needs to be done and just moves forward to do that for our community. I think I mentioned this with her passion, but I do always see in her that her focus of doing her work is to serve our community. And I think that's a really unique and amazing trait that she brings to our department. She's also one of the most organized people I think we have in our department. She has binders, and I love it. She knows where everything is, and we can all learn from her in that way. But she's a great member of our team, has been here a number of years, and we're just really grateful to have Lisa as part of the BCHD team.
And if I might add, so Lisa has, in addition to just her role and her job responsibilities, Lisa never shies away from doing extra and going above and beyond to serve the department. When we went through our strategic planning process, a formal strategic planning process 4 or 5 years ago, Lisa was really one of the staff members who behind the scenes was driving a lot of the work of implementing that plan forward, leading small groups, ushering work plans forward. A lot of that was some of her organization, but it was also her passion and just really desire to have the department be of good service to the community. Lisa also spent many years as a union steward because she wanted to not only serve the community, but serve her fellow employees in that role. And again, just assuring that the department is in a really healthy space to be able to do the work that we need to do. And if I'm recalling correctly, Lisa, you started at the health department as the TPIP program, which was not in substance use prevention. Is that correct?
Yes.
Or TP3, thank you.
Preventions. Yes.
Right. And I've so appreciated that you always find a place to serve and find the need and are always willing to meet what that need is. You've been involved in our IDEA team and just many other things. So I really appreciate your service to our department.
Thank you.
Yeah.
Thank you.
And I think one thing would be remiss in not saying, just with that, as Nikki said, like she's willing to adapt. She's brought her team that way. Our entire public health promotion and prevention team are all cross-trained as case investigators and have been juggling that during this time too. And that's really huge. And I think Lisa's leadership of that team made that happen. So that's been very appreciated.
Thank you so much. Thank you.
We
Can I have a
appreciate you
few
modeling.
words?
Absolutely, please.
Well, I was delighted. First of all, I thank God for the privilege and the honor to be celebrating this milestone, professional achievement. And when I came in this morning, this wonderful appreciation certificate was awaiting me. And when I think of 20 years, I go, wow. So I've seen a lot and I've done a lot, and I hope to continue to fulfill the mission and the vision of the health department. I'm here. And thank you. again, appreciate it.
Thank you so much. Just, it's a real joy to know you and have you here. So thank you for
As an
joining.
old guy out there, I'd like to say, Lisa, it's been a pleasure through the years. It's been absolutely great. I've always found you to be incredibly helpful and a wonderful partner.
Thank you so much, Dr. J. Appreciate it.
Very good. Thank you. All right. I wish I was there to shake your hand.
Yeah, yeah.
All right. Or maybe even give you a hug, huh?
Yes, yes.
All
Virtual, virtual.
Virtual hug.
We can still do
Yeah, that's right. All right. Thank you very much.
Sure.
Moving on to financials, Lisa. Thank you very much.
So in your packets are November financials. I'll run through a couple of one or two numbers, I guess. So in the revenue section, again, we continue to flow COVID funding through, and you can see that in the federal and state grant funding. Through November, we are 24% or 857,000 over budget, and 750,000, which is 20% favorable to last year. COVID-related funding is expected to total about 670,000 by the time we get through the end of the year. Permits and inspections continue to be favorable to budget. We're up 65,000 over budget and 33,000 over last year. I expect that we will maintain that favorable variance through the end of the year. Medicaid, Medicare, sorry, I lost my place. Medicaid, Medicare, and private insurance clinic revenues are under budget 36%, about 90,000, and down 36,000, which is about 20% under last year. Again, COVID related, the clinic's been was closed beginning back in March for a period of time, and we've just seen less traffic through clinic related services. I think we're going to end the year 85,000 under budget. Federal in-kind vaccinations, again, this is sort of a repeat variance. We're under budget 25,000 and under last year 49. Doses distributed through September 30th of 2020 were 38,000 in 2019 and 27,000 in 2020, a decline of 28%, which was a decline that we did a little bit better than the state average. On the expenditure side, we're beginning to catch up on the salaries line and fringe. We are 100,000, 2% under budget for those combined, but we're over last year by 475,000, which is 11%. We generally come in under budget by the end of the year, but with additional staff that we've added for COVID response, I think we're going to probably be close to budget by the time we get through the end of December. There are COVID related expenses that are reimbursed through health department funding. It's getting a little bit confusing. So you will see some shifting of expenses from the health department books to the county books for some CARES Act funding that the county has received. Those entries are going to start rolling through significantly in our December record. So I know there's been some discussion on the county side, commissioner side, about some shifting of that funding. By the time we get to the end of the year, through the end of December, we will have shifted, I think, about 310,000 off the health department funds onto some CARES Act funding on the county side. we've also received through different pots of money, overall funding reward awards, totaling through December 30th, we will have spent $775,000 on the health department side, including labor and other reimbursable expenses. There's carry forward amounts that will happen into 2021. I have not seen it all flow into our contract as of this moment. The state has been a little bit slow in kind of adding those amounts into our comprehensive agreement. So I'll keep you updated as some of those changes happen. Right now, I'm expecting somewhere in the neighborhood of about 1.5 million of remaining funding that is going to flow for COVID-related expenses to flow into 2021. There's items, I don't know, I've covered some of these before in prior meetings. Medical and program supplies are under budget and under last year. Last year included Benton Harbor water filters for about $237,000. Contractual services are over budget in 2020 by $67,097. $35,000 of that were King Media related to our marijuana program, some advertising services. 19,000 of that variance, or almost 20, was contracted services for Area Agency on Aging, the medical management grant. Travel is under budget, basically COVID related. We haven't done the anticipated travel. Equipment purchases are 104,000 over budget. 74,000 of that is related to COVID response. Vehicle purchase, tent purchase, some basically clinic, offsite clinic related expenses rolled through there, plus computer equipment for new staff, office related expenses for new staff. So at the end of the day, we're still looking at revenue exceeding expenses by $393,000. There's some year-end adjusting entries that are going to come through. So I'm not ready to commit us to exceeding revenues by that amount. So if you look at the fund statements, we're going to do better than our budgeted use of fund balance of $528,000. I think we're going to come in closer to a use of 280, which is about 247,000 better than we had budgeted. A lot of moving parts. So I should have, the next time we meet, I should have a better idea of where we're at as far as fund balance goes. Any questions?
Lisa?
Yep.
Yeah, I have just a question. With the federal and state dollars that we're receiving for the COVID support, I guess, is that a solid number? And will that be, in your judgment, enough to cover all of the responsibilities and requirements and tasks of the health department?
We continue to run projections, Joe. I believe we should be in good shape as far as our staffing levels now. What's kind of out there and still questionable in my mind is what funding we're going to receive for our vaccine effort. So the state has yet to come through with any funding directly related to a vaccine, even as we're ramping up. So I expect that those funds will begin to flow. And so it's hard to predict right now. I think we have funding to support our current staffing levels at least through September and more than likely through the end of the year.
Nikki, do you want to address that at all? No? Okay.
I have a question. I was just wondering, in regards to special things like COVID response and even like the water filters and things like that, I see that you're merging this in with the general budget. Do you possibly or have something separate to say, this is how much we have spent for equipment, personnel, for COVID or for water filters, or is it all just involved with the health department?
The numbers are, that's a really good question. I could, I suppose, given sort of the materiality and significance, maybe do a supplemental report that would, Vanessa, that would break that down. And the numbers are definitely flowing through our financials, but I understand your question. You kind of want to know what the pieces are. Correct? Am I understanding?
Yeah, I thought that would be a nice thing to be able to look at, to,
Okay.
you know, understand. It would help me understand better how it fits into our total budget.
Okay.
Other questions from the board? Lisa, I have this vision of you with 100 plates spinning. So-
It's yeah, there's a lot of different pots of money for whatever reason that make it a little messy. Why it's coming to us in hunks and pieces as opposed to kind of giving us the flexibility to allocate where we want to is confusing, but we're doing the best we can, both on the health department side and on the county side. So making sure that we use our funding to the best of our abilities.
Well, thank you so much. We really appreciate all you're doing and what a pro you are. So thank you. All right. Before we move to the Health Department administrative reports, I just want to say thank you for the social media presence. Nikki and Jillian, you're quite a team with Spectrum Health. Just really appreciate those updates, those Facebook, very positive, good information. Kina King has done a great job with her moments, and I knew the website was really well done and the tracking, but I didn't have an idea. As I looked at some of my colleagues in other states and the information they had, I realized that what you're doing is extraordinary. I just want to thank you for it. It's just so well done, so professionally done, and also the media releases. And I just can't thank you enough for the interviews that you've done and just the drumbeat in the paper. I just find it phenomenal, and it didn't stop during the holidays. So I just wanted to say thank you. Very well done.
Thank you.
Thank
We
you, Peg.
appreciate that. Yeah,
Very well
Jillian.
said, Peg. Very well said and very accurate. You guys are unbelievable. I've looked at other websites too. And you guys are just the best. Your communication, your clarity, professionalism, you're on a par with anybody in this country.
Jillian has put a lot of time and effort and brain power into that. We've got one of the best PIOs in the state. So
Thanks, you guys. Very
Funny.
grateful.
I like you guys on Facebook and I get none of that. It's interesting.
So you haven't seen the Facebook Live?
Yeah, watch those.
No, I mean, I'm not getting any updates from them on Facebook, but that's another.
Sorry, the Facebook algorithm.
yeah.
Well,
Linda, I can
I'm
help
sure.
you with that. I can help you to make sure that you see all of our updates in your
Yeah, I mean,
newsfeed.
it would be, that's why I liked you, is because I wanted it. So it is the algorithm, I'm sure, and whatever. We'll talk about it later, never mind.
Yeah. Yep. Appreciate that.
Well done. All right. So moving on to the administrative reports.
Yep, I'm going to share my screen so that you can see the data. So just to give you an idea of where we are in terms of community transmission, because there's just been a lot in flux and changing really over the last 2 months or so. So this right here is the epidemic curve for really the entire pandemic, going all the way back to March. And you can see that in October and November, we had this incredibly steep increase in our number of cases. Just before Thanksgiving, we were maxing out at an average of 165 new cases per day. And that was really an untenable workload. And as you get higher on this, you change what case investigation and contact tracing looks like to try to do the most meaningful touches, since we can't do everybody. Following Thanksgiving, there was a little bit of a decline. And I think at our last board meeting in December, the main takeaway at that point was we're not really sure what to make of this yet. It could just be an aberration in the data or less people seeking out testing. But we really have seen a sustained decline in cases. We've had a couple of declines and a blip up and, a couple of those, but on the whole, we are trending downward in terms of cases. And now we're sitting between 35 and 45 new cases per day on average, which is still more cases than we wish were out there, but that is definitely in a much more manageable place. And we're not seeing the really high amounts of COVID cases that we were pre-Thanksgiving. And we haven't necessarily seen a particular fallout from the Christmas holidays, although Christmas and New Year's tend to be celebrated in a little bit more spread out fashion than Thanksgiving was. So, but we do have a bit of distance here and we're not seeing some sort of huge spike in cases. Incredibly grateful for that, because we do know that there were a lot of people in our community who made choices that were difficult in how they were going to celebrate their holidays so that we didn't have a spike going back to both Thanksgiving and Christmas and New Year's and all the other holidays in there. There have been a lot of really diligent efforts of our community and hard efforts of our community that I think have really contributed to some of this decline. So we're very appreciative of that. And to put it in a little bit of perspective, we also look at our percent positive testing rate. And you can see as our cases were climbing dramatically in November, our percent positivity was doing the same. As you would expect, percent positivity is continuing to decrease. We're seeing a little bit of just kind of variation. This will probably be a flattening out for a period of time, we hope, around this level. But we're dancing around that 10% figure, which is far better than this 20% figure we were touching, 5-6 weeks ago. So on the whole, as you would expect, as we are having fewer number of cases, we're seeing our percent positivity come down. And we're doing that in a climate of a dynamic testing environment. And so the testing strategies, test availability, all of these things do have an influence on our number of confirmed cases and our percent positivity. We were at a peak in terms of average number of cases per day that were happening about the week before Thanksgiving. And we were averaging about 1,300 tests per day at our peak. And it has been on a little bit of a decline with less both demand for testing, which is normal, that sort of follows suit. When there's less cases, there's less demand for testing, but also when you do less testing, there's less cases. So it's a little bit of a chicken and the egg, but there's a lot of evidence pointing towards we're having fewer cases, therefore less demand for testing. At the same time, there was a switch from Spectrum Health Lakeland, which is certainly not the only game in town doing testing, but they do a lot of testing in Berrien County. They did, for a period of time, switch to only testing symptomatic people because there was some constraint on test supplies. So that did also impact the number of people that were tested and therefore the number of positive cases we're finding. This decline in the number of tests that are happening is not necessarily a concern. It's mirroring demand and need, but we're continuing to keep an eye on that. It looks like it might be starting to level off a little bit. So we're continuing to watch. The thing that's probably the least impacted by a testing strategy and one of our best, canary in the coal mine as to what's happening is hospitalizations for COVID-19. And so this graph does show back to April, the hospital census, the 7-day rolling average of hospital census for COVID-19 positive individuals. And similar to our confirmed cases, and as you would expect, as we were seeing that big increase in cases in October and November, we started to see steep increases in our hospitalization. Now, it wasn't increasing at the same rate that our number of cases was increasing. We were seeing 10, 12-fold increases in cases over a 2-month period of time. Here we saw maybe a 6-fold, 7-fold increase in hospitalizations, which is encouraging. And it did peak at just over 80 per day was the census, but we have seen a pretty dramatic decline in the last few weeks of December in those number of cases. And we do expect the hospital curve, the peak and also the decline, it's going to be a couple weeks behind the confirmed cases, because generally speaking, people with COVID don't often need hospital level care. If they do need it, it tends to take several days into the course of their illness by the time they are hospitalized. So the fact that we're seeing this decline really start mid to late December as opposed to, or mid to late November, that's to be expected. So we're encouraged. We were at a point where we, as you recall, we were quite concerned about potentially overloading our healthcare system. I would not say that this is done and that threat is over, but we have avoided something pretty major happening here in the fall. I think our healthcare workers are still definitely feeling the stress and the strain of more people in the hospital, more cases, but there has definitely been relief over the last few weeks, and it's very welcome relief, so that we were never getting to the point where healthcare was being rationed or we were really strained to take care of all the healthcare needs in our community. And this last graph, it's a little bit difficult to kind of smooth this out, but this is deaths deaths among people with COVID-19 in Berrien County. And as you would expect, there have been some more cases, and we have seen an increase in that death trend. The highest levels we've had here, just to give you an idea of scale, if you can't see those numbers, these are 5 deaths per day. A little bit towards the end of November, but it has also been on the decline, as we would expect to follow our declining cases. We did here in November have a couple of long-term care facilities that did have outbreaks, and we have seen the tragic outcomes of what happens when there is transmission of COVID-19 in these long-term care facilities. And so this is a remnant of that. We have really had pretty much stuck to the trend of it is older adults 80 plus that are most likely to die of COVID-19 in Berrien County, and that is a similar trend across the country and the world. It is people that do have underlying comorbidities and other risk factors that put them at increased risk. But on the whole, we're not seeing anything very surprising in the data, and we continue to be encouraged by the slowing trends and the decreasing trends that we are seeing. So, I mean, at that point, before we transition to vaccine and other components of the response, I'd be happy to answer any questions on the data or trends.
I just have one correction. I wanted to also recognize Courtney for her public outreach. Sorry about that, Courtney. So I know you too were there. My apologies. So
there's a whole team behind the scenes in that. It's not always the faces you see.
Yeah.
I'd just like to make a couple of comments about what Nikki's data, which is accurate, of course. But I would say that Michigan continues to do a vital records review on deaths and pairing up anybody who's had a death certificate in the last 30 days with anybody who's had a positive test. So if you look at the numbers for yesterday, the number of deaths recorded for the state of Michigan was 189. But the little asterisk, which you look down at, was that 117 of those deaths were from vital records reviews. Certainly some of those were directly COVID-related deaths, but most of them, as their actual table says, are COVID-involved deaths, which mean you had a positive COVID test sometimes or other, and sometimes weeks before, whatever happened. So I think that's worth noting. From a hospital care standpoint, our hospital's doing a great job and is been very active, for instance, in monoclonal antibodies. And nationally, monoclonal antibodies have been pretty successful for those people who just before they might have to be admitted to the hospital. And nationally, it's less than 5% of people have any significant, side effects from it. And of people who are started on monoclonal antibodies nationally, the number of deaths is like 6 or 7%, which is that obviously is good. And I would just say, just to highlight, every Berrien County resident that has died has had comorbidities, every single one. And way over half of our deaths are over 80. And that's also true of the state of Michigan. Half of the deaths in Michigan are in people over 80. I'm not minimizing people over 80. I'm heading that direction. Sometimes it seems faster than whatever, but that is a significant number. And less than 1,000 of the deaths of the 2,000 something other deaths in Michigan are anybody under the age of 60. So I'd just like to throw those numbers out there in terms of just a little perspective on it all.
I'd like you to change that 60, please. Just raise 62. It up.
62 help?
No.
Not yet, Peg, because the vaccines.
Yeah, that's right.
Right.
Oh, that's right.
About how the schools are coping and faring this new year now.
I'm sorry, it was hard to hear you. You said how schools are faring?
How the schools are coping with the epidemic and how things are working out with them.
Yeah, I mean, on the whole, I think things are continuing to go well. We touched base with superintendents last Wednesday to kind of finalize any decisions that they may have been just thinking about of what to do in response to, do we open again in person after Christmas break? Do we go virtual? Do we take a few days to go virtual and then in person? So it's my understanding that most of our public schools did opt to just jump right back into in-person instruction on Monday. We do have our weekly meeting with them later today, so we'll touch base with the schools. I think on the whole, everybody was just really happy that the current epidemic orders do allow for in-person instruction for grades 9 through 12, as it hadn't prior to. So I think there was a lot of excitement there. And I think right now people are turning towards, when do we get the vaccine? How do we get our staff vaccinated? And how is that going to help? Which that is the question on a lot of people in a lot of sectors' minds. But I would say on the whole, schools continue to go well, continue to be pleased. Granted, we've had a 2-week break here from schools and some of the reporting, but we have a documented 550 confirmed COVID cases amongst Berrien County students and staff. And for some context, there's about 25,000 Berrien County students and an additional 3,500 school staff. So I'd say on the whole, we're quite pleased with how things are going. I continue to be very grateful for all of the benefits that our students are receiving from those that are doing in-person education, and that our schools were willing to take that chance on trying the new health and safety measures. There are other communities across the state that are trying to figure out how to open up after 4 or 5 months of virtual and trying to figure out what makes it safe to do it now when it wasn't safe in September. So I don't know, that's probably more than you were asking for, but I think on the whole, things are continuing to go well. We have great partnerships with the schools, good communication, and we're working through all of it in lockstep.
Yeah, we
Dr.
really.
McBride, Dr. J.
I just want to say one thing about schools. The work that's been done to keep the schools open is other counties, like Nikki said, want to know how we're doing it. And it's because of a great partnership. So it's really, to me, it's fantastic that this is happening. And I just throw one extra thing in. The MHSAA, the athletic division, actually, you may get a question about this as a board member, has allowed the fall sports, the fall sports finals to happen in terms of tournaments and et cetera. But they rolled it out in some kind of pilot program where any athlete who's participating has to get tested 3 times a week with an antigen test and maybe more. That's all mandated. It's very confusing. It's a poorly conceived program in my mind. And you may get some questions about it. But actually, the one football team we would have had in it opted out And the only people that are in are two towns' swim teams, I believe, is all that's really in. So it's not really affecting us all that much.
Colleges, I believe, reopen face-to-face the 18th in Michigan.
Yes.
Yeah.
And so, but before we can go back to Andrews campus, we have to be COVID tested. So we are all scheduled the next few days for COVID tests. So I think you're right. I think the schools are being very cooperative on this. And if we don't do a symptom checklist every day at Andrews, HR sends us a threatening note.
That's good. We want employers to do the screening, so glad to see the follow through.
A comment as well?
I have a question.
Could we, just a second, could Linda had her hand and then we'll get you Vanessa and then Ray. Okay, go ahead, Linda.
Do you have any theories or thoughts about the spike this fall between sort of October 1st and Thanksgiving or after Thanksgiving? Do you have any thoughts about what that may have been from?
So there's definitely some thoughts, and we'll never really know for sure. I mean, some of this could have been the just normal ebb and flow, and you could really argue that everything we talked about as a first wave in April and March never really came through, and that we just had a susceptible population, and that was our time for more cases. We definitely had more testing available in the fall than we did in April and May, so we were able to detect more of those cases. But then there's also some other just social things. I mean, we know that by fall, and once you started getting into later in September, and in September, people were really just feeling somewhat over this. We all feel over it, of course, but and are tired of the preventive practices. But I think there were some people that were saying, well, we can start meeting in larger groups. Nothing happened. More gatherings started to move indoors. There was some relaxing of the executive orders in mid-September that did allow for larger gathering sizes and for gatherings to happen in more spaces because the data supported it at the time. Sure. So, I mean, there's any number of things I don't think we'll ever really know, but that it could also have just been part of the normal ebb and flow of being in a pandemic.
True. Okay, thank you.
And just like to add one thing, there is also the natural history of coronaviruses. This is not like every other coronaviruses, but it does share features. Coronaviruses are a November through April phenomenon, and it depends on humidity, et cetera. And in northern areas of the United States, this is when you would have expected a second wave, just because of the nature of it. And even in states that didn't do significant shutdowns, lockdowns, or whatever, like South Dakota, Wisconsin, and a few others, they had the same kind of curve of rapid increase and then decrease like we did.
Yeah. Okay, I saw Vanessa, I think, with a question, and then Ray.
Oh, my question was, it's been a while ago, a few weeks ago, on the Berrien County website, I saw a job for a school nurse. And I was wondering, is that job for all of the schools or just a particular school? I don't know, just a question.
I don't know that we're familiar with what job posting you're speaking of. It definitely wasn't a health department position.
It wasn't? Oh, okay.
Mm-hmm.
All right.
So I'm not sure.
Okay.
Okay. Ray, did you have a question?
Yes, I do. Yes, I do. Nikki, I'm sure that everybody, I'm not sure if everybody does, but something I do. I monitor a couple sites every day. One of them, obviously, our dashboard, and another one I look at frequently is a site that I found that's posted from the New York Times, and huge discrepancy between especially the deaths. The number of cases seem to be spot on, but the number of deaths is a big discrepancy. I was wondering what your thoughts might be on who's the right number. I'm tending to believe us, not somebody else that's compiling statistics elsewhere. But I'm just looking this morning, and the comparison's about 20% difference between this national site versus what we're seeing with our local sites posting. Any thoughts on that?
Yeah, so I mean, without knowing exactly where that national site is pulling their data from, my guess is that they would be pulling it from the state, and our dashboard is frequently always out of sync with the state's dashboard on deaths. Part of that is because the state counts probable deaths, and our dashboard is confirmed cases, deaths. There's also the vital record review that Dr. Johansson referred to, and all of our deaths do undergo a review process as well. And some of the notifications of how we hear about somebody from the hospital who may have died and may have had COVID, we definitely feel as being good stewards of the data, we want to make sure we understand if it was a COVID death before we list it as a COVID death. So sometimes that review process can take a little bit of time. And so that timing gets some things out of sync as well. But I think it's the probable cases. There are a lot more cases that are being classified as probable because of antigen testing. So I'm sure many of you have heard about the Abbott Binax Now rapid antigen testing. There are other ones out there on the market as well. But those rapid antigen tests, if they produce a positive result, that's only a probable case. It doesn't meet the case definition for a confirmed case. So we're seeing also more people who have COVID have been diagnosed and are technically a probable case that could be contributing to these numbers. Dr. J, I know I'm certain you have something more to add here.
Well, just, yeah, what you pointed out is exactly right, Nikki. And the other thing is, so even on the MDHHS's website, there's a little graphic about in people who had a positive antigen test, Binax and one other, most all Binax, and then had and it had symptoms, and right after it had a PCR, more than 20% of the positive antigen tests were false. So more than 20% were false positives. That's a fairly significant high number, actually, which is why confirmatory tests with a PCR are needed for the antigen test when the symptoms are confusing.
Thank you.
Right. Are there any more questions before we move on to the vaccine? Yes, Dr. Edwards. If you'll unmute, please.
Yeah, just some observations. One is the decline in admissions is very interesting, but also reflects a significant paradigm shift in how patients are being treated when you compare that to April. The number of people that are being treated aggressively as outpatients is really remarkable, and a credit to the physicians at Lakeland, really amazing. I was curious, and I wonder if Rick could comment on this. There seems to be sort of a geographic shift in distribution of this disease, and now very significant on the West Coast, Los Angeles and Arizona. Obviously, this does not reflect a cold weather phenomena. Los Angeles is overwhelmed, Arizona is overwhelmed. And Rick, I was wondering if you could comment on that a bit.
Sure. So it's when I talk about coronaviruses, it definitely behaves differently in temperate in northern climates, such as Michigan, Vermont, New Hampshire, across the board like that. A lot of these studies came out of the Nordic countries initially, that the northern countries are the ones that are northern countries are the ones that have this temperature phenomenon, whereas in temperate climates, that's not necessarily true. So in areas like Florida, Texas, Southern California, stuff like that, they do not follow the same seasonal kind of pattern with coronaviruses that the northern colder climates do. So I hope that helps a little bit. The other thing is that it also hits communities differently depending on, like in the South, when more people are together indoors in air conditioning versus in the North when more people are outside, which is definitely always better, that is also going to be a phenomenon. And another phenomenon is also what area has actually been hit. And as that area is hit, did it get your nursing homes? Because that's especially true when you're looking at deaths. So when Texas had the big run that it had a while back, it wasn't in Houston again or in Dallas. It was in places like Amarillo that never had a surge in the spring. And then then their numbers really driven by surges that happened later. Does that help at all?
All right. Go ahead. Somebody had a comment? All right. Thank you very much. Let's move on to the vaccine update.
So I'm going to turn it over to Courtney to give us the meat of this update. At real high level, we've started vaccinating our healthcare workers and our priority group 1A, and it's just, that is a very exciting and hope-filled time. So I'm going to turn it over to Courtney to tell you a little bit more about what has been happening and then what is coming and what we're planning for.
As Nikki has mentioned, we are in full vaccine mode, especially in our 1A group. And just a reminder that 1A group has been hospitals. So the health system has received their own allotment of vaccine and are responsible for any of their staff. And then as well in our community as both of the federally qualified health centers, so InterCare and the Niles Family Health Center, they both received small allotments of vaccine to do their own staff. So that helps a little bit, of course, with who falls into the public health pool, as well as the National Pharmacy Partnership. So a number of our skilled nursing facilities, our adult foster cares, assisted livings have been paired with Walgreens or CVS pharmacy, and they get 3 different visits from that pharmacy to help with vaccination. From what we have heard and know, some of those visits, especially for our skilled nursing facilities, have started. Many others are still waiting to be scheduled, but that has also started with the National Pharmacy Partnership. So for us, that leaves a number of others. There's still some gaps with skilled nursing facilities, adult foster care, so we're filling that in. We've done some special clinics for our EMS providers, EMTs, medical first responders, and nursing in that way to get some of our first responder clinics through. So that was, even within all of these phases, there's priority tiers, and that was priority 1 for us. Priority 2 is the support of the long-term care facilities. And so we're continuing to work through that. Of course, we can't vaccinate if someone is sick, and we have to have consent for all residents. So there will be multiple visits in there to make sure that we get to everybody. For the few facilities that we're responsible for, we're trying to do staff when we go on site. If that's not possible, those staff are also welcome to come to any of our clinics. So there's a couple different options to make sure that we're getting to everyone. As of this week, we are fully open to phase 1A. So that includes all other healthcare providers, everything from physicians, dentists, optometrists, those who are involved in direct, like embalming and mortuary science. So lots of different individuals in that category. And so we're working through that. We had a robust clinic here yesterday. As we mentioned, we're trying to have consistent clinics. We're actually working to scale up for next week and have even more clinics happening. This week, between our actual on-site larger clinics, we are still going out and have field teams going to adult foster care and long-term care units. So that takes some of our nursing staff away to make sure that we're able to do that. It's just not reasonable to bring all of those individuals to another site. So we are hosting many sites here at our Benton Harbor office. We have a system set up where you have a check-in in the parking lot, and we have wait queuing in cars. You head in, you get your vaccine with a nurse, and then we have kind of a wait monitoring area set up, and we have some staff who go over things like the V-Safe program. That's that CDC federal monitoring for vaccine safety program, as well as just answering questions as they come up about what to expect after vaccine, and having that monitor. Once you've had that 15 or 30 minutes in some case, some people are recommended for longer monitoring, you're able to head back out. So we were able to do that yesterday. I think we had about 150 people through our clinic, and it went really well. We actually have more clinic spots, so we're working to continue to get invitations out and make sure that people know that there are spots available. We're actually going to be in our drive-through setting tomorrow, so we're still trying to have at least a day a week where we're getting out and moving around the county. Still a clinic format, but we're in a different location, if that's just a little bit easier for some people to get to. So tomorrow we are doing that. We should be able to get a number of individuals through. We're trying to really look at our clinics and fill them We do not want an open spot at any of our clinics. We want to make sure that those are filled. So trying to get enough of those invites out, and then we're even starting to think through what are some strategic partners we can call upon to say, we still have 10 spots left. Who can we get in? Who haven't we reached out to? Jillian and team did support this week. We did send out a press release at the beginning of the week because our team here, especially over the last couple weeks with the holidays, we've tried to do a really deep dive from anything from where can we query license information on state websites to rudimentary Google searches to just identify who are all the people in our community who fall into this group. That being said, I'm sure there are other small groups that we have missed in that. So we did send out a press release this week that just let the community know we were open to 1A. Here's what 1A means. And if you haven't heard from your employer or the health department, here's how you get in touch with us, the health department, to get you connected to a clinic. So right now, those clinic registrations, while we want them filled, it's not just posted on our website, it is a by invitation. So we do have a fillable form on our website. Someone can go, they can put in their information, let us know their profession, their employer. And then from that information, we're collecting that. We're kind of taking that in two tiers. One, we can get an invitation once we vet that that person falls into phase 1A out to them to schedule an appointment. But that also helps us identify what employer they have to cross-check any other list to say, oh, that's an employer we also need to work with to make sure any of their colleagues get this. So it's kind of serving a twofold. So far, we've gotten some good responses there. Many of them are duplicates, and that's okay, but we're getting that in and we're working to do that. So that's where we're at with 1A. I would say that it's hard to know what this number is because a lot of our 1A number is crossed with Spectrum Health Lakeland. But I would say somewhere in the 4,000 is what we were kind of thinking in our community we have in that phase 1A. We're hoping we have all 4,000 who want vaccine, but with many studies and different things, we've seen that current uptake is around 50%. So that's our goal, get those in. If we can get everyone else, that's great. We'll keep having clinics as long as we have vaccines. So anyone who's interested, we're gonna staff clinics as long as the state gives us vaccine. That's how we're moving. Right now, as a reminder, we only have the Moderna product. We are considering what else we can support and make sure that, again, as we schedule clinics, we have vaccine in stock to support those clinics. We are very rapidly planning for phase 1B. We anticipate moving there quickly and probably quicker than we expect. Phase 1B with the CDC guidelines is 75 and older. So any residents, there's no qualifiers other than 75 and older, as well as some critical and essential infrastructure workers. And there is a list that goes with that. We can make sure we share that out. I know that we're actually working on some more community communication to go out around that. It's really targeting that critical infrastructure that has to show up and do their work in person and is supporting some of the wraparound pieces that keep the health system running and our healthcare entity running, because that's still our goal, right? We don't want to lose sight and overburden our health system. So some of those 1B individuals would be police and fire. So we did the EMS providers, but going back and wrapping around and getting our first responders, the 75 plus I already mentioned. Some of our other congregate settings that aren't necessarily long-term care. So corrections officers, juvenile settings, our shelters would be part of that. And then moving into educators. So it is pre-K through 12. Anyone associated with that education system and childcare providers. And then there's some other subsets under there, but that's really what we're talking about when we say 1B. And then when we get to 1C right now, that is 65 and over and chronic conditions, but we're really rapidly providing for that 1B and planning, trying to get those numbers, working with a number of partners. The Area Agency on Aging has been really instrumental in helping us identify who are those numbers, especially when we're talking about the 75 plus. We're going to have some more meetings with them this week, as well as Spectrum Health Lakeland, just to work through How are we reaching individuals, especially those who maybe are less mobile, or where can we set up in the county? We are certainly going to be working, so you are all aware, with senior centers to have some specific outreach to our older population, whether that's information going out in newsletters to potentially some clinics on site at those locations. We really want to make sure that we are getting as many people in as we can in a day, but that we're adhering to the same safety protocols we want everyone to do. We don't want to have clinics where we have people too close to each other and are getting their vaccine and also exposure, right? That's not our goal. So we want to be really aware of that. So that does limit some of the locations we can use right now. But when we set those up, we want to be able to get a few hundred people through each of those days. So we're working on staffing plans. Right now, we're using a robust combination of our staff. So lots of thanks to our team who are continuing to shift and pull and be molded. We are going to start working more over the next couple of weeks to really identify where we can have volunteers fall into that mix. So one thing that I'm sure we've said at past meetings, we've said it here a lot, but maybe not here. Whatever vaccine cadence we're doing now has to keep growing. So we're doing dose 1 for phase 1A right now. As we move into 1B, we still have to do dose 2 for every single person who came through now. So we really have to be thinking of this as a doubling cadence. And we also have the other reality. We have other public health functions that can't just fully stop. There are things we have paused. There are things we have changed to accommodate what we need to focus on for the community right now, but we can't just stop some of those functions. So we really want to incorporate some volunteers to make sure that we are using our staff where we need to, have volunteers wrap around, and then being able to double in the next couple weeks so that we can really reach everyone we need to. I think right now our biggest limiting factor that we're going to have to continue to watch, and we can keep you updated, is going to honestly be our vaccine supply. I think that we can schedule clinics, we can get people scheduled. We have in the last couple of weeks actually established an online scheduling platform. So we don't have to get 1,000 phone calls or have people take a long time. It's an online system. You get a link to a website. You can go in and pick any clinic time you want, put your information in. It's really easy. It helps us make sure that we have vaccine available and ready for each of those clinics and to plan forward and to fill in holes. But we have to keep having vaccine coming. We're definitely on every state call that we have about that, listening and hearing. We got that initial shipment of Moderna. There are a few weeks of delay that we are not able to get anymore. The state's shipments of Moderna all were redesignated to the long-term care partnership with the pharmacies, which is a vulnerable population and rightfully so to be a priority. But that means that what we got is what we have for a couple weeks. We're trying to really work with Spectrum Health Lakeland. We meet with them multiple times a week to ensure that we're in lockstep and not duplicating. They have numbers and have been allocated vaccine, make sure that they're using that, we're using ours. We'll continue to have those conversations once they get through their staff. I'm sure there will be other partnerships as we move into the broader community of who's doing what. But that's what we're watching right now is we need the vaccine to keep filling those spots, and we're gonna make as many clinics as we can to use that. I'm sure you've seen across the state that there is a big push from MDHHS to use your vaccine that you have. So we're certainly doing that. We just hope we keep getting more, and that's what we're planning for. I think those are the big things we're working on right now. I'm happy to answer questions, or Nikki or Jillian, anything that's missed in that, Dr. J.
Okay, so Dr. Edwards has a comment. Dr. McBride had a comment. So Dr. Edwards, do you want to go ahead?
Yeah, I was just, one of the things that I've been fortunately getting my second vaccine tomorrow, but my concern in the healthcare setting has been the tremendous misinformation that many people have about the vaccine in general. And I'm seeing a surprising reluctance on the part of people to want to get the vaccine. And I'm just wondering, what's our plan on more of a grassroots level to really educate our community about safety, about the vaccine and the absolute need to get it. Do you need volunteers to go and talk to communities? Do you need testimonials from people to go to communities? Because the success of this program obviously is completely dependent on massive participation in this endeavor. Very happy with the fact that this vaccine has been rolled out, but I'm very concerned about these pockets of reluctance to get the vaccine and wonder what we can do to help.
Yeah, I think that that's a good question. I think Jillian probably has some response to that too, and we'll keep bringing this back to you. But we are working with partners, especially out of Spectrum Health, Lakeland Population Health, to work on how we are doing some of that grassroots communication, how we're getting information out to our different populations. Again, I think even with our seniors, that's where some of our work with our senior centers comes in place. I do have you on the list as well with Meals on Wheels, Linda. But really reaching out to who are the trusted partners in people's lives and making sure we're equipping those partners with that information too. I think that that's going to be really important. That work is certainly underway to do a lot of that confidence building. Jillian, I don't know if you want to add anything specific. I know a lot of things are in the planning pieces already.
Sure, absolutely. So we do have plans to engage with just different trusted spokespeople throughout our community to help make sure that those messages of safety and efficacy are being spread and that we can counter any misinformation that may be out there. Just earlier this week, Dr. Johansson did publish one of his At Your Services, which is kind of a bulletin for healthcare providers specifically that provided a lot of resources. The CDC has some great resources available for healthcare providers to have tools and talking points that they can use with their patients directly. We know that when it comes to vaccine hesitancy, a strong recommendation from a healthcare provider, a trusted doctor or nurse, or someone with a healthcare credential in anybody's life can be the most influential kind of person to convince someone to get a vaccine. So that's definitely a primary method that we're using. We meet weekly with Spectrum Health Lakeland to collaborate on our communication efforts between the health department and the health system as well. So that is certainly ongoing. And then I would just make the comment too, that while we do know there are still a subset of population that have hesitancy and may feel unsure and have unanswered questions that we are working to address, we're also balancing that with a subset of the population that is very eager to receive the vaccine right now. So it's a both and message of, hey, we want you to get this, but you need to hold on for a minute because we don't quite have enough supply for everybody right now. So that has been difficult to balance that message overall. And it seems that we at the health department seem to be hearing overwhelmingly from the people who are interested in getting the vaccine right now. So I do feel that a lot of our messaging has been towards that audience, but we have absolutely not forgotten the fact that we need to continue to build confidence amongst those that may still feel hesitant.
Right. And I will say, like, early on, there were studies that were saying, 40%, 50% of people were interested. As the vaccine has actually made an appearance, those percentages have increased. And I would even say this is incredibly anecdotal, but even here in our community over the couple weeks we've been vaccinating, individuals from same organizations who were not interested before, once a few colleagues went through, then we're like, oh, wait, I would like an appointment too, and are adding on quite quickly. So I think that even personal sharing of why you got the vaccine and what's happening in organizations is really impactful. And that's purely anecdotal, but that has happened just from knowing how the registrations have flown of, oh, we're now ready, which has been pretty rapid over the last couple of weeks. So that's important too.
We encourage people to take selfies after getting their vaccine and share about it with their friends and family. That's been a good way to get those positive messages out there.
Dr. Edwards, did that address your total question? Because I kind of heard a speaking component as well. I'm not sure if that's what you meant.
I think that I'm very interested specifically what we're doing into the communities that are more underserved. and tend to have a little more skepticism about safety when it comes to any type of healthcare. Specifically, I'm speaking of some of the areas of Benton Harbor and Niles that are going to need, I think, more direct communication and outreach as we move forward. I'm very concerned about adequately immunizing those communities.
Well, where Ken is exactly correct. I mean, those are the two areas that are, somewhat the most frustrating. Some of it's understandable. So just to talk about what Ken said about the medical community, in the counties in California now that are the epicenters of actual terrible stuff really happening in a big way, less than half of the medical people in those counties are opting to get the vaccine. This is in the epicenters where they're actually seeing the worst of the serious illnesses. So that's one very frustrating thing. And then also across the nation in African-American communities, there's been a reluctance, understandable based on past things with vaccines, et cetera, but troubling now since that's a very at-risk community. And that's happened in Michigan and across the country. And so you're right, Ken, I think both of those are important to address. And, getting leaders from both the medical community and the African-American community to be advocates and champions is, I think, going to be a key.
Another piece of this, and this is part of our just ongoing health equity strategy, but part of gaining trust is continuing to be very trustworthy and show that trustworthiness. And so a hallmark of what we've been trying to do throughout the pandemic and again throughout vaccination, trying to be really transparent so people know exactly what's going on in the process, because that type of transparent communication, even when the message isn't always what people want to hear, I think that does help build some of that trustworthiness. So that's another thing we're trying to do. I mean, granted, that's a long-term strategy. Over years, that takes a lot of time, but I think that's an important piece too.
You certainly did it with the water filters. That was an amazing job, to build on that. All right, I'm looking at the time. Are there any additional questions on the vaccines? It looks like in the chat there's been, so Joe, do you have a question? Come close to your microphone if you would, please.
No, I don't have any.
I can talk to your second shot planning just for a quick minute. It looks like that was in the chat. We are definitely thinking about that. And I know I referenced we have to double our cadence because we'll be doing first and second. But just to Julian's point that she put in the chat, we do put all of the vaccines are required to in MICR. And so that system has some features that allow us to be able to do recalls and text or mail individuals that it's their time to get their next vaccine. In addition to our scheduling software allows us to do some emails to say, you're now 28 days later, schedule, and here's the registration form to get those in. As we continue to plan, there could be occurrences where we only open clinics for second dose and try to do some second dose specific clinics just to get everybody through. But that is part of our registration now, even that we're asking first or second dose. We have had a few in that 1A, in that first group, who live in Berrien and are licensed in Indiana. There've been some rare occurrences. Someone has actually gotten vaccine 1 in a different area. So we're keeping tabs on all of that and making sure we have that information to get people to the second dose.
Thanks.
And I guess, Peg, just before we move on, because there has been some activity in the chat box, I'd like to go through and just read all of those to make sure they get on the record and anybody who's watching on YouTube sees that. So Linda made the comment that we have information that we, referring to Meals on Wheels, has information on 400 seniors who are receiving meals and don't have overlap with Area Agency on Aging. So that could be a good use of getting information out to seniors 75 plus. Jillian said thank you, and that the Meals on Wheels is on the list of organizations to help spread messages. Dr. McBride asked if Group 1A should fill out the form, or do we want 1B folks to fill it out to begin the scheduling process? And I don't recall if we answered this explicitly, but right now we're only scheduling the 1A individuals. Courtney just spoke to Joe Wasserman's question about second shot plan. And Jillian did answer. Right now we're focusing on phase 1A. We want to have a survey link ready for people who want a vaccine and fall into phase 1B, but it's not been published yet as we are not there. Vanessa asked if people who are immunized are placed on MICR. And Jillian responded in the chat box, yes, all the vaccines are entered within 24 hours. Linda mentioned well thought out rollout and planning. Joe said any data on the duration of vaccine efficacy from the trials. And I don't know if we specifically answered that or not, but I think the studies are ongoing for length of efficacy. Dr. J, do you have a comment there?
It's certainly more than 9 months, and that's as far out as it's gone now, but it's more than 9 months, and the antibody and the anamnestic response that happens then is good. So everything about that is encouraging.
Great. And then the last comment, it's great to see from Dr. McBride, it's great to see how well you have organized in scheduling. I have colleagues in Florida waiting in line for many hours and a first come, first serve call. So.
Now that's what I literally have gone at 5 a.m. in a stadium waiting to get a vaccine.
Yeah, we're glad that's not our system too.
All right, very good. Thank you for the report. And we have a different way we're handling resolutions. If you'd like to explain that and
yes.
go through resolutions.
Yeah, so it is a little bit odd that we have resolutions under the administrative reports, but these are resolutions or approvals from the Board of Commissioners that have actually already happened. They happened since our last board meeting due to some rapid action that was needed. So we wanted to go back and tell you kind of what happened. So that's why you're seeing them on a different portion of the agenda. So each of us had kind of have a different one. So I'll toss it to Courtney to talk about the SWIMBA contract.
Sure. So the SWIMBA contract, which is Southwest Michigan Behavioral Health, SWIMBA, is our regional entity that is responsible for our prepaid inpatient health plan. So they received our funding from federal and state and designate here locally for substance use disorder funding. So this is our yearly agreement that we receive. It came a little later this year, I think, with budget shifts, federal and state. They were waiting for their budget to then come to us. But this is an acceptance of our October 1, 2020 through September 30th, 2021 budget. It is an annual budget of $268,601.85. But basically that's a breakdown. There's block grant fundings in there that does include our PA2 funding, as well as this year there's some funding in there from the state opioid response funding. So basically the services we're doing all continue, but they just fall under different funding buckets. So that is our yearly acceptance of that agreement, just brought to the board for accepting that funding and moving forward for the fiscal year 21 work plan.
So I think I'm next on the list for the Sickle Cell Disease Association agreement. We have a sickle cell social work representative that is available to clients as needed. We have an agreement for $750 a year and a space set up for that individual to be available to clients as needed. So that agreement went through last Thursday through the Board of Commissioners. So again, this is $750 for use of a space.
I think I'm up next with the United Way Be Healthy Berrien contract. This is a contract with our friends over at United Way and Be Healthy Berrien with the 4x4 Health and Wellness Grant that we are in our third year of now. We work very closely with Be Healthy Berrien, and that steering committee serves as the community coalition that is a requirement as part of that 4x4 grant. Be Healthy Berrien was due for some strategic planning within the group there. And so part of our 4x4 grant budget this year did have some funding, $3,000, that would support a hired strategic planner to facilitate that process for Be Healthy Berrien. So that is what this contract with the United Way and Be Healthy Berrien was for, out of the 4x4 grant.
Thank you. Okay, Lisa?
Me again. So the Meehan legal stack. So Meehan is Michigan Health Information Network Shared Services. And we use an electronic health record that through Patagonia, that our billing system that requires a link to the Public Health Information Exchange. So this particular agreement is at a cost of it's a membership fee at $125 a quarter, $500 a year, that allows us to exchange that information. The agreement basically defines along HIPAA lines and those, and agrees that how we'll handle public health information.
And just to add that, I mean, that is pretty routine. We've had this relationship in place with the Great Lakes Health Connect, but Great Lakes Health Connect and MyHIN legally merged. And so because of that, our agreements needed to, they needed us to re-sign the agreements because it was with a different entity than it was the first time due to some mergers in the background. So this is something we've had in place since we had our first EMR. The last one here is the bit of the outlier. This has not actually gone to the Board of Commissioners yet, and this is the first it's seeing any amount of light of day. But we do wish to enter into an agreement for a contract for some services with the Whiteman for some programming of our COVID-19 dashboard that's on our website. So we have both an external facing public dashboard on our website that you all can see. We do also have an internal dashboard that feeds staff and internal decisions and has some other data that is important for driving the work, but not necessarily for public consumption. And these dashboards display data from a wide variety of sources, and there's a lot of things that have to happen behind the scenes on a daily basis to pull data from the sources, get them into Excel spreadsheets. The way these dashboards are set up in ArcGIS, they need an amount of coding that go from the Excel spreadsheet to the dashboards. Whiteman has been doing this work because there was an existing relationship between our Berrien County ArcGIS department and Whiteman to do this type of thing. And so there was some work that did happen without a contract. It was more of just a fee for service, a little bit out of a time. There's a little bit more things that need to happen with the dashboard. And so Whiteman has said that they will no longer do work without a contract. We're still working in on honing in on the exact scope of the services, but we do expect that it will be between $3,000 and $4,000 for their coding services to make all of this come together. I think it's really, these are the dashboards that we are using, and this is the path we need to continue down to make sure that we can continue to make meaningful sense of our data and communicate that clearly. So hopefully, we know we don't have all the details before you. We would like to be able to move on that more quickly. So we would like to be able to take a resolution to the PHS committee next week to get this going so that we don't continue to experience further delays in getting the work done.
Are there any questions on the 4 resolutions that were approved and the one that's going? Do we have a person from the county board who has been designated to be on the health department board?
Yeah, that's a great question. So the Board of Commissioners is meeting tomorrow, and that is when they will have their organizing meeting, and they will vote on officers and appointments and all of those things. So we should know tomorrow afternoon who has been appointed to the liaison of the Board of Health, as well as who is the chair of the PHS committee. As our parent committee, Bill Chickering was the chair of that committee. So we'll see who gets appointed to fill that position and whatever other reshuffling of assignments they may or may not choose to do.
All right, thank you. so I didn't miss any questions. My apologies if I do. We have had the Community Health Improvement and Recovery Plan overview on the agenda a number of times. Is it your pleasure to do that today, or what are you thinking?
Courtney, I think we have time to do that. Would you agree?
Yes, yes. It won't take us too long. We'll do a high level overview so we get that covered. So,
All
are we
right,
good to start that now then? Okay.
please.
Let me try screen share and get the slides.
Well, Courtney's, there, you got it. Okay.
All right. Are you guys able to see that okay?
Mhm.
Okay, great. So wanted to share with you, I think we had talked about a while ago, our need this year to do a community health improvement plan. Early in the year, in midst of early pandemic, we really decided that recovery, we started to talk about what does recovery look like? And I think we're in a ebb and flow of response and recovery still, of course. But we really evolved our plan to really think about how does it need to be impacted? Our community health improvement plan obviously was going to need to shift and encompass some of the ongoing needs and post-pandemic needs that were going to come forth. So that's where the word recovery kind of came into this title. But over the last couple of years, we've done many preparation activities for this, the community health needs assessment in partnership with Spectrum Health Lakeland, the local behavioral risk factors surveillance survey. Sorry, let me get to the next slide for you. Has all led up. So in public health, once we've done that community health needs assessment, the community health improvement plan is really about what are you doing to address the needs that were identified with the community. And so it becomes a roadmap of sorts, if you will, for how the health department and partners, this is a community roadmap, not just a BCHD roadmap, are going to move forward to identify priorities and really identify what strategies fall under them to improve. So with COVID being a part of the planning process this summer, we definitely had to shift. We had already been planning for this pre-COVID-19. However, we had planned over the summer to host town halls and community gatherings and be able to do community engagement in that hands-on way. Of course, that wasn't possible. But having community voice and engagement has still been the fundamental piece of doing this plan. So you probably heard early on, we had surveys that we did this summer, electronic and paper. We had a community steering group that really worked forward, but we wanted to ensure that we were encompassing all of those partners still even amidst COVID-19. And so with that, the process that we've used for the community health improvement plan, it's a process called MAP, so mobilizing for action through planning and partnership. And so really it's just a way to go through the process to ensure that we're doing all of the steps and making sure we're being thorough and having community voice in each of those. So we developed an internal core team, and Lisa, actually, who was on this morning, was part of that team. So we had an internal core team who came together to really outline how are we going to move through this over the summer and early fall, what that was going to look like. We spent some time really engaging community members and assuring that the priority health needs that had come out in the community health needs assessment were still relevant. I think we really learned that they were, and even more so in the time that we were seeing with COVID. So they had not gone away, if anything, had grown in their need. And so we did do a survey with community partners and in local settings, so for local community residents, to start to share so here's what you said were the problems, were the areas we needed to focus. What do you see changing that, improving that, and getting some of those actions and strategies from our community? And so that's the piece that really took most of our time over the summer and fall, and that I'm going to outline more here. What we're moving into in this early year is that continued sharing, continued partnership around who's doing what pieces of the plan, and then building in some metrics and accountability to really track that. So So what this looked like is there was a survey that went out July to August that really talked about, so the two top things that came out were mental health and then obesity rates in the county. So we asked questions of what things are getting in the way of mental health? What actions would you like to see? The survey was pretty quick for people to do. We also did a lot of outside of grocery stores and other common community areas. We had set a goal of getting 1,000 surveys in a few week time span to be able to inform our work. We were able to get 1,001, so that was good. We were happy with that. But that survey helped inform our next steps. And then just really quick, this is small, so I'm sorry about that. Nothing that you have to see in detail. I just wanted to show we had really good distribution of who completed that survey. We tried to work really hard to ensure that we did some deeper dives in underrepresented areas of our county. We wanted to make sure that we did as best job as we could to get a representative sample with that survey. So we were happy that we got a good distribution when we looked at age, when we looked at race, as well as even income. So that was something that we did track as we moved through. But then the big piece from that is really setting goals and strategies. So to help do this, again, we had envisioned doing this in large community settings, but we did the survey to engage our community. And then what we did is pull together a steering team for our work around goals, actions, and strategies. And that was made up of 15 community members from across Berrien County, community leaders and think makers in the county who wanted to be a part of that. We came together for 3 different sessions to look at the results of the survey, to spend some time visioning, to set goals, and then to begin to look at the strategies under it. So the vision that was set was to build, foster, and sustain a community that seeks, acknowledges, and addresses the root of problems, addresses inequities and stigma, and builds people up to more fully support the process of health and healing. There's a lot of conversation in these meetings around a lot of the work that the department and many of our partners have already been engaged in, but moving forward in a way that's trauma informed and resiliency focused and really rooted in equity. That was really the heart that we heard from our community members around that table, that we heard in the survey results that came back. We did share those survey results with everyone in that group. So again, as we've been moving forward, transparency has been the biggest piece of moving us forward. We want to make sure that the voices that we are hearing from the community are being shared with those who are doing this goal, action, and strategy setting and are informing our work. So from that, we set 4 goals, and you'll see those here. I won't read them. I can certainly send this out. But for time, I won't read through each of those, but we set 4 goals to really center the work over the upcoming year. And what you'll see in these next slides are really just early snapshots. What we are in the piece and process of right now is aligning more with partners and engaging partners in work to say, here's the goals that were set. Here's some of the action and strategies we heard from our community. Where can you come in and wrap around that? Where can you take lead? Because again, the Community Health Improvement Plan is not only a Berrien County Health Department guide, it's really supposed to be a community partner guide. So we're working through that right now. Spectrum Health Lakeland Population Health Team has been a really big part of that. In full honesty and disclosure, we are moving slower than we would like, but that is also very indicative of our current COVID time. But it's also really relevant that a lot of this work is getting done in pieces as we move forward and can continue to inform even our response in COVID. So in each area, just to give you a taste, within each goal, there were activities and strategies identified. Within that, we have larger tables that are starting to identify partners and other individuals and timelines. A community health improvement plan really usually covers a 3 to 5 year period. What we have really focused on, certainly our goals and many of the activities you'll see in here, will take longer than a year. They are a 3 to 5+ year in work for us. However, what we really tried to focus on as we moved through, and so you'll see this happens under each goal, is what is needed and possible and maybe most, I don't want to say most important, but most urgent in the next 12 to 18 months. So trying to find what can we do in 60 days? What can we do in 90 days? What can actually get done in the next year? And then part of this community health improvement plan, as we continue to work forward with our partners, is there should be a yearly review where we come together and say what pieces of this were able to be accomplished, where can we keep moving, how are we keeping this relevant? So a lot of the things you see, this isn't a one-year plan. This is really supposed to be in between. It will overlap, I am sure, with our next community health needs assessment, which will be a checkpoint as we move forward. And will allow us to either continue to have some of these activities going, to embed them in different partnerships in different areas of the community, or to continue to shift course as we identify new community needs. So that's the work that's really been done over the fall. As I mentioned, the piece of the work that we're really engaged in now is moving to partner and community accountability. We want to make sure that if we're saying and heard from the community, this is the goals we want, these are the actions and strategies we think will get us there, that we're being honorable of that, and that we're also being transparent of where we are at in the process. So setting up some systems to really evaluate and monitor. So what kind of data can we pull and can we pair with some of these areas, whether they're small measures that we can do timely, or what areas do we need to track over a longer period of time. Upcoming behavioral risk factor surveillance survey and community health needs assessment, of course, will be big checkpoints, but we want to have smaller data in there as well to know that we're making difference and that we're moving in the right way. We'll continue on the health department side. Some of this will integrate directly into the work that we'll lead and that we're doing. We'll ensure that it's aligning with our strategic plan and our performance improvement and performance management metrics. Envisioning at some point being able to have dashboards for this and being able to share with the community where we're making that headway, where we're making changes, and then really just continuing to have this long-term improvement. So this is a process that will be iterative, that we will keep doing, but it's kind of the first rotation of a community health improvement plan after the community health needs assessment. We hope to really see a lot more movement in the next 3 to 6 months on this as we have that partner engagement and can really put some feet to some of the actions in that outlined plan.
Very
And that's
good.
a
Thank you
quick
so much.
high-level summary.
Yeah. Well, I'm glad we got to it. It's so important. I'm amazed that you've been able to do anything. So thank you. It's one of the most critical things we can do for health in the county. So questions, thoughts? All right. Thank you. We're moving on to the Board of Health discussion. Just one item from me. There is a sewage appeal today, so we will have that meeting at 10:30. Any other discussion or comments or anything?
We continue to be grateful for all you do and making us look good and serving this community. You guys are just wonderful.
I have a question.
Yes, Vanessa.
I was just wondering, I don't know, I thought, are we supposed to vote on the resolution for the Whiteman COVID dashboard services or no?
We don't have the resolution prepared yet because we're still ironing out some of the details of the contract. So just wanted to let you know that that was something we would be working on. And we don't have the time to hold it to February to bring it to the Board of Health first. So in February, we can bring you where we landed.
Okay, I just wasn't clear on that.
Yep, sorry for the confusion.
Oh, thanks for being on it though, Vanessa. I wasn't on that question. All right, seeing no more hands. Jillian, are there any public comments or questions that we need to address?
There are no public comments.
All right, then we are adjourned until February 3rd.